Molluscum contagiosum is a skin infection, also known as MC, that is caused by a virus that produces lesions and bumps on the upper layers of your skin. These bumps are sometimes called water warts. The virus is active in children and active in sexually active adults and teens. As long as the bumps are still visible in the skin, it is always contagious. The virus can show up anywhere on the skin, but the most common areas of the body are the legs, groin, and arms. It is in unique cases that the virus sometimes goes away on its own without any treatment. Ways of causing and transmitting MC. By touching the lesions on a non-infected person. Children contacting each other through normal play. Teens and adults more likely to become infected through sexual contact. Through sports, such as football and wrestling, where athletes share the same equipment. If an infected person touches a towel, clothes, or toys, can cause another person to become contaminated. You even can spread the virus in other parts of your body through scratching and then touching another part of your body.
Hi, my name is Mary, and I wanted to share with you my first experience of hearing the term Molluscum Contagiosum. I had a nephew who had it 2 years ago. He came home to visit, and he had bumps all over his face. We sent him to the doctor, and finally they diagnosed him with Molluscum Contagiosum. There was no cure for it, they just had to go away on his own. But I just wanted to share with you that I've heard of the term Molluscum Contagiosum because of my nephew first experienced it. Thank you.
The most common way to prevent the spread of the virus is simple. Just don't touch anybody with the infected virus of MC. But here are some helpful tips, such as like washing your hands with soap and instructing your kids or young kids, children, to properly wash and scrub their hands with soap and water. Do not share the brushes or combs or towels or clothing or bars of soap with anyone. Athletes or if you just go into the gym, do not share the same equipment as any other body in the gym or in the locker room. Don't touch your skin that is infected with MC. Don't scratch it, don't touch it, don't do any of that. Bumps should be kept clean and covered to prevent touching or spreading of the virus. If you are infected in any area where you shave, don't touch it. All you would do is irritate the virus and cause it to spread, and now you have to throw away your razor. Most importantly, if your genital area is infected, be mature enough and don't have sex. Treatment for molluscum contagiosum, also known as MC, however, cannot be treated. It can fight out on its own, actually. But here are some treatments that can help. Cryotherapy is a liquid nitrogen used to freeze each bump. Curettage, a small tool is used to pierce the bump and scrape it off the skin. Laser therapy, it uses a laser to destroy each bump. Topical therapy is used by creams containing acids or chemicals that apply to the bumps to induce peeling of the top layers of the skin. The immune system determines how long or extreme the virus can last. One should look for the following symptoms: very small, shiny, and smooth in appearance, flesh colored white or pink, firm and dome shaped with a dent or dimple in the middle, filled with a central core of waxy material, between 2 millimeters and 5 millimeters in diameter, found anywhere except on the palms of your hands or the soles of your feet, usually present on the face, abdomen, torso, arms, and legs, located in the inner thigh, genitals, or abdomen in adults. Did you know that molluscum contagiosum is commonly found in children under the age of 15 years, and through the first 4 years of their phase of the virus is when they're affected the most? Or the fact that most cases of MC will clear within 2 years? People have to remember, until the bumps are gone, the virus is still contagious. The bumps can sometimes be mistaken for cancer or even chickenpox. That is why an individual should get to the doctor or dermatologist to determine and give a proper diagnosis.